Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
So welcome to the Oncology Revolution. I'm Marta, your host for today. I'm a functional medicine certified health coach with a background in sports science and a master's in teaching. I've walked closely with the cancer journey for both of my parents, and that experience radically changed how I see health, healing, and prevention. I learned that symptoms rarely tell the whole story, and that true healing asks us to look deeper, to zoom out, and to question what we've normalized in modern healthcare. And today's guest is someone who embodies that same philosophy and who spent decades challenging convention to transform how we understand oral and systemic health. David Roze is a biological dentist and the founder of Roze BioHealth, the first biological dental clinic in the Middle East. Trained in France with degrees in dental surgery, neuroscience, and implantology, he combines rigorous academic training with a lifelong passion for challenging convention in healthcare. Through his 3 Dubai-based clinics, David Roze and his team offer a fully integrative approach, blending cutting-edge, non-toxic dental protocols with whole-body therapies such as gut support, IV therapy, fascia release, and traditional Chinese medicine, all aiming to reduce inflammation and promoting lasting health. In a world where unexplained symptoms like brain fog, fatigue, chronic inflammation, or recurrent infections are often misdiagnosed or ignored, his work offers a radically different lens, one that sees the mouth not as separate, but as a mirror of the body and central to the whole body health. David, it's a pleasure to have you here and welcome to the podcast.
Thank you, Marta. Thank you very much for having me in this podcast.
Yeah. So before we dive into your story, I would love to begin with something a bit more personal. What's something that made you feel especially alive or grateful this past week?
This past week, I had the chance to have my daughter and the newly husband that came to us. So it was a great pleasure. You know, they got married 1 month ago. So we had all the family, and then they went into a honeymoon, and then they came back. So that was the last week. That was the beautiful part of the week.
Oh, amazing. And congratulations for your daughter. Thank you for sharing. Okay, so I always like to go back to the beginning, because our why often shapes the work we do in powerful ways. What first made you start questioning traditional dental care? Was there a specific moment, personal or clinical, that made you realize that the mouth wasn't just about teeth, but a gateway into the body, into systemic health?
I think the first, it began with the different clinical approach that I saw in Dubai. You see, Marta, when I arrived in Dubai in 2003, I was fascinated to see how different countries approach dentistry. So I had Swedish colleagues. They never gave antibiotic because in Sweden, giving antibiotic for an oral problem is considered like a malpractice. And while in France, where I was trained, we usually overprescribe antibiotic. I saw also that in India and across Asia, I saw dentists using plants and natural remedies with incredible success. So I think it reminded me of my own mother. Remember, she treated me with homeopathy. And the funny thing is that when I was a student, I rejected it because I thought it was lacking science. But life has a way of humbling you. So, yeah. And anyway, the real turning point was, of course, my daughter's illness. And you're right, when she was 15, suddenly, I was no longer just a dentist. I was a father watching medicine reduce her to a protocol. So I was a bit frustrated because at that time, you see, no one asked about her diet, about her stress, daily habits. And I felt at that time that they treated her as a diagnosis. and not just as a human being. And so that broke me, and that shocked me. And I realized that I didn't want to do conventional dentistry anymore. And from that moment, I knew I had to practice differently. So to look at the mouse not just as a teeth or as an infection, but just as a mirror of the whole body, and sometimes even survival.
Yeah. Yeah, absolutely. And you were right. It's so fascinating how different countries see things differently. And to be honest with you, I never thought that in oral health would be the same. And the example that you gave is incredible. How the prescription of antibiotics can be so differently seen, right?
Yeah, and Dubai is a great place to see that, because we have dentists or practitioners from all over the world. So it's nice to see the different approach, and you get educated by your colleagues, basically.
Yeah. Yeah, and one thing I find is that even many healthcare professionals still underestimate how much the mouth impacts the rest of the body. And there is growing evidence that oral inflammation is a hidden driver of chronic conditions, right? Including cardiovascular disease, dementia, autoimmune issues, and even cancer. And despite the research that we have linking periodontal disease to systemic inflammation, cognitive decline, and even cancer risk, oral health remains one of the most overlooked pieces in chronic care. Why is oral health a critical but often missing piece of the chronic disease puzzle?
Yeah, it's a great question, and it reminded me of actually one of your posts, Marta. In one of your posts, you said that 80% of the communication between the body and the brain flows upward, and the brain alone doesn't work when the body is stuck in stress. And you said it perfectly. But the mouse is a perfect example for that. Why? Because stress is not only psychological. You see, it's not only your boss who argue with you, or your husband. It's also a stress that can provide from mechanical or biochemical issues. So, for example, in the mouse, you have metal fillings, especially amalgams, the one with mercury, and they can act as constant stressor, and they can create local toxicity, triggering allergies and driving chronic inflammation in the surrounding tissues. So the problem is that oral issues are often silent. So you mentioned gum disease, but it doesn't hurt at first. But we know from different studies, I remember the study from Socrates in Harvard, that periodontal disease releases endotoxin, which enters the bloodstream and triggers systemic inflammation. And of course, chronic inflammation from root canal treated teeth or residual necrotic teeth are going into the body and creating some alteration for the whole immune system. So, and I remember that this inflammation, it was Weston Price 100 years ago, who talk about focal infection. So basically, the focal infection is when you have bacteria that goes into the rest of the system, and that's it's been proven again since. But basically, when you have a good bacteria in your mouth, it can become a bad bacteria when it travels inside another organ, another part of the body. And we really need to look at this silent stressor through the blood, through the lymph. It can go also through the sinuses. And when it disrupts the immune system, it's the whole system that's falling down. And that's why we see the strong correlation between the gum disease, the periodontal disease, and the cardiovascular disease, but also brain disease like Alzheimer or cancer. The chronic inflammation impact the body in different disease, in different chronic disease, and up to the cancer.
Yeah, absolutely. And I like how you how you talked about the endotoxins that can be released, and it can be a two-way road, right? The systemic inflammation can be driven by other factors, but can also be driven by these imbalances in the oral health. And if we don't dive deep into it, we won't know, or if we don't look at the whole picture, we won't know what is it. Because like you said, it can be hidden stressors.
Correct. And we need to explain what is endotoxin. So basically, in the mouth or in the gut, you have a lot of bacteria forming the gut microbiome or the oral microbiome. These bacteria, they release some waste called endotoxins. So when you have bacteria in the tooth, for example, in a dead tooth, they release outside of the tooth, in the body, in the system, some endotoxin. And we call this phenomena the endotoxemia. And it's been proven recently, actually, by a Polish researcher that metabolic endotoxemia are going and passing the blood-brain barrier. So it alters the brain issue. So you have the cells that regulate the brain cells, so the neurons, and they are affected by this endotoxemia. And if you have, for example, a dead tooth in your mouth, the endotoxemia bioaccumulate. And after years and years and years, it creates some potential neurovascular disease, especially there's disease in the brain like Alzheimer.
Yeah, wow, that's incredible. How most people probably won't think that some brain diseases can start in their mouth, actually.
True.
Right?
Yeah.
You talked about the gut, and the gut-brain connection nowadays gets a lot of attention. But digestion and immunity, they begin in the mouth. And the oral microbiome plays a crucial role in regulating inflammation and sending signals to the nervous system. Can you speak to the role of oral microbiome and how it might drive or disrupt the overall health? I mean, we kind of touched a little bit already, but if you can, how does it influence the gut, the immune response, the brain, and long-term systemic health?
Yeah, I mean, you're absolutely right. The mouth is a true starting point of the gut-brain axis. So the oral microbiome is the first line of digestion and immunity. And when it's balanced, it protects us. But when infection like gum disease, periodontal disease, or infected root canal are present, bacteria and inflammatory molecules enter the bloodstream and the gut. So this disrupts the gut microbiome and drives the systemic inflammation, and that has been linked in studies to conditions ranging from leaky gut and cardiovascular disease to Alzheimer. I remember this cardio specialist who said that bacteria leaking and going into the heart create some microclot, and that can create this cardiovascular disease. So if you have a modification, an alteration, or an imbalance with your oral microbiome, you will have, or you will end up with an imbalance of your gut microbiome. So you need to balance both. You cannot only look at once. That's why separating the dentistry from medicine, it's not correct. It doesn't make sense. We need to look as a patient as a whole if you want to understand, if we want to heal this person.
Absolutely. And how this might explain, symptoms that we often see in practice, like anxiety, food intolerance, chronic digestive issues.
So what we need to look at is to find the root cause of the issue. And sometimes when the patient comes to our clinics, they mention different symptoms like brain fog, or they mention that they have chronic fatigue. They mention different things like that. And we are not used to this kind of symptoms. We are used, or we are educated by having patients having a toothache, but not really brain fog. But they're all related, or they can be related to an imbalance in your oral microbiome. So we need to check this kind of thing and put in connection the oral imbalance or the infection, chronic inflammation, with another part of the body that can be linked together. So we really need to see the connection between a disease in the liver, for example, or the thyroid, for example, and an infected tooth. And that link, we trace that through symptoms that describe the patients.
Okay.
For example, I'll just give you one example. If a patient comes with some brain fog, you will do a test, and then you will ask some medical history for this patient. This patient will tell you, yes, I have some issue with my thyroid. I have a hypothyroidism. Okay. Then you do a CBCT, which is a 3D scan of the mouth. And you will find that there is an infection of a dead tooth on the upper left molar. And we know through Chinese medicine that there is a meridian connecting this specific tooth with the thyroid. So you cannot help the patient treat the thyroid if you don't remove this infection that you have in your mouth. Because every day you have a release of bacteria and endotoxemia into the thyroid through this infected tooth. So you need to link these two organs together. And usually it's through CBCT, of course, clinical examination, but also understanding the symptoms that the patient has.
Yeah. I will go to the piece on your clinic and how you do this integrative approach. But since we are talking about that, I want to mention, so your assessment is already different from a conventional dentist, because when people come to you, you're not just looking at what's going on with their teeth. You are actually listening to what are other symptoms that they are experiencing that might be a result of also what's going on in the mouth, and not only. And then it is really fascinating for me how you even bring the Chinese medicine to understand what organ can be connected to the teeth.
Yeah, I mean, biological dentistry is a whole. You cannot be a biological dentist if you don't understand the different aspects of medicine. For me, it's not a trend. It's dentistry practice with full awareness of how the mouth is connected to the whole body.
Yeah.
See, traditional care often focus only on the tooth in front of us, but biological dentistry is about protecting the immune system. So we try to reduce the toxicity. We try to support the body natural healing with every intervention. We've built our practice with this philosophy, and we try to adapt these protocols to the need of the patients.
Yeah. So since we are talking about biological dentistry, and for those unfamiliar with the term, right? Because biological dentistry might sound just like another buzzword, but your work proves otherwise. So how would you define biological dentistry, and how is it fundamentally different from traditional dentistry, both in philosophy and in practice?
So I was talking about the philosophy where we see the patient in full. If we want to go more in details, I think we try to understand, we try to talk and to hear the patient needs. And then after that, we adapt our protocols. So for example, we believe that we should not have metals in the mouth, because these metals can harm the patient, can create chronic inflammation, especially with the saliva, because it creates lots of corrosion. But you have also, we don't want basically any metal in the mouth. We don't want any chronic infection or chronic inflammation. So it's very important that we start by removing old as mercury filling, but using a specific protocols. We call it the SMART protocols. It's called from the EOMT. It's International Association of Medicine and Therapy. And we use basically rubber dams, high volume suction, oxygen supply, and stuff to protect not only the patient, but also the staff from mercury vapor. We have other type of protocols. For example, in surgery, instead of relying on antibiotic, we strengthen the patient's immune system first. So basically, if you want to come to me and you tell me, I need to remove this tooth, I will tell you first, we will boost your immune system. It can take sometimes 3 weeks, 4 weeks. And then we'll use IV, we'll use ozone, we'll use PRF, which is platelet-rich fibrin. And all that will allow faster healing, less inflammation, and as a biological, not the use of drugs or antibiotic when we can, actually.
Yeah.
So it's more prevention. We really try to be preventative. Same for the hygienist. I mean, every patient should go to the dentist to have a cleaning of their teeth every 4 to 6 months, I would say. But then we, as biological dentists, don't use fluoride anymore. We think that fluoride is toxic, very toxic for the body, not for the teeth, for the body. And evidence show that fluoride can accumulate in the pineal gland and contribute to calcifications. So instead, we use hydroxyapatite. It's a natural mineral that rebuilds enamel and protects teeth without toxicity. So you see, we really try to dig deeper and try to find non-toxic solution, non-toxic elements for the benefit of the patients.
Yeah, that is fascinating, to be honest. So the whole approach, besides looking at the person as a whole and protecting the patient's system through not using toxic materials, right, which is very new for many of us. It also works to strengthen the system instead of causing a little bit of imbalances, which can happen when we treat it conventionally, right? With antibiotics, it will have an impact on the gut and so on. So it's a whole new way of looking and doing, from what I'm hearing.
Yes, it's true. We really do not harm the patient. It's our first and utmost motto. We don't want to use anything that can create locally or in time some affliction for the patients.
Yeah. So what are some of the early signs in the mouth that something deeper might be going on in the body?
You know, when you have gum bleeding, that's usually a big sign, because that is just a consequence of usually gingivitis or periodontal disease. But when you look further or a bit deeper, having gingivitis or having periodontal disease, it's already too late. It's because you have an increase of Fusobacterium. It's a specific bacteria that is, I would say, present in the mouth, rarely in the gut. But we find that bacteria, that specific bacteria, in few cancer, like the colorectal cancer. So you see, a good bacteria can become a bad bacteria when it's not in the right place.
Wow.
Yeah, so we need to check and test the bacteria that you have in your mouth to see if that can create disease, gum disease, and later on more chronic inflammation and different type of disease like the colorectal cancer.
And may I ask you, how do you test to understand the oral bacteria?
So it's a simple test. We collect basically a bit of your saliva, and we send that to the US, and 15 days later we'll have the rest of what we test 10 different bacteria, the nasty one, and we see the concentration of them in the mouse. And if they are unbalanced, then we have to treat that.
Yeah. Okay, so this podcast is all about revolutionizing cancer care, and we were talking about cancer, right? And we know that chronic inflammation and toxic exposure are major contributors to both cancer development and to poor treatment outcomes. In your view, what role does oral health play in cancer prevention or integrative oncology? And, what does the science show us about how you already mentioned this one, which I'm super curious about, the connection with that bacteria with a colon cancer. But what does the science show us about how oral infections, the mercury fillings, or the root canals might affect the immune system and even increase the cancer risk?
Yeah, I always say this very clearly. You cannot have a healthy body without a healthy mouse. The two are inseparable. So when the gums are bleeding or there is a hidden infection in the root canal, that infection doesn't just stay in the mouth. So we know now that bacteria and toxins travel through the blood and they can stress the immune system day after day. Over time, this inflammation, this chronic inflammation, has been linked to cancer, colon cancer, lung cancer, even esophagus. Okay, so we know that some bacteria, certain bacteria, like the one that we mentioned before, the Fusobacterium, have been linked in colon tumor, and they have made cancer treatment like chemotherapy less effective. And I would like to show you how does it work. So we understand that the gum disease translate or an infection that you have a dead tooth, creating some chronic inflammation. Okay, now we have chronic inflammation. So how the chronic inflammation affect the cancer? And we know that one of the big discoveries in recent years is that chronic inflammation is not just a side effect of cancer. It actually helps cancer grow. So around every tumor, there is an environment. Let's call it a neighborhood made of immune cells, okay? And the cancer cells stimulate inflammation through messenger, like the interleukin-6, and they can also trick certain immune cells, like the T cells, into switching off our natural defenses. So you see, if we have a chronic inflammation, that creates a kind of shield that allows the tumor to grow, spread, and even resist treatment like chemotherapy. So that's why we have now new therapy that will not just attack the tumor, but that will also try to break this toxic environment and wake up the immune system again. So I'm talking about the checkpoint therapy. And we really want to make sure that we restore the immune system as well as we fight the tumor cells. So I think it's very important that we fight the chronic inflammation. And in the mouse, you have, of course, the chronic disease. So we need to make sure that your oral microbiome is balanced. But you need to check also that you don't have any dead tooth. So I'm talking about the root canal treatment, infected root canal treatments, where you have obvious periapical infection. But you have also the cavitation, or it's called the FDOG. I don't know if you know what it is. It stands for fatty degenerative osteonecrosis of the jaw. Few dentists know about that. Lechner is the one who researched a lot about this cavitation. And what it is basically a hidden area in the bone. And it's usually left behind, especially after wisdom tooth extraction. It's very, very common. And when the bone doesn't heal properly, what it makes tricky is that usually it doesn't cause pain. So patient doesn't see that, and it stays there for years and years and years, because the wisdom teeth, you remove them when you are in between 18 and 25, I would say. And they stay there, and they create some inflammatory issues. And we see that's very important, because we see lots of inflammation-based messenger called brown tests or CCL5. But there's inflammatory messenger are not the same that we can check when you do a blood test, for example. You really need to test this kind of blood test specifically. If you don't see an inflammation in your body, and so you will miss this inflammation that you have in the jawbone. So we need really to trigger this silent hole in the jaw because they're constantly raising inflammation in your immune system. So that gives you stress into your immune system and decrease, of course, the immune system.
Wow, that's new for me, to be honest. And I can see how important it would be for us, for anyone, but especially for those also dealing with cancer, to actually test for this specific inflammatory marker, right?
Yeah.
Because as you said, it can be something that is silently contributing to the inflammation, which is already one of the driven factors. And sometimes you don't know.
Martha, you know where we see also a high concentration of frontes, other than just the wisdom tooth area? We see them very specifically in breast cancer.
Wow. Okay.
So it's important to check and make sure that we don't have any residual chronic inflammation or chronic infection inside the mouse.
Yeah. And I know there is some care with the dentistry part and cancer patients. I mean, I don't have an idea of how it is in Dubai. My experience is with Portugal.
Yeah.
But what would it look like to better integrate biological dentistry into cancer care? With oral health practitioners working alongside oncologists.
I think we should, first of all, we should not separate dentistry from medicine. I always remember this teaching that we have. All dentists have this kind of teaching at university. When you have a cardiovascular disease, before going to the operating theater and operating on your heart, the cardiologist will always send you to the dentist and tell you, go and check with your dentist if you have any obvious dental infection. Because we know that the bacteria that you have in your mouth can go and leak to the heart. And during the procedure, during the hospitalization and the heart surgery, the patient may have a risk of dying, causing what we call endocarditis. And that's something that every dentist knows. But if it's true for the heart, it should be true for many, many other diseases or other organs. So I think we should have a strong collaboration between biological dentists and medicine and physician.
Yeah, and I think that is a central piece in any even integrative clinic or center that we see, but we do not see many yet. And one thing that I deeply appreciate about your clinic is how you blend the cutting edge dentistry, but with integrative health, right?
Correct. Yes.
Like I said, from fascia release to gut support to IV therapy to traditional Chinese medicine. How did this full body approach come together, and how do these different modalities work together to support the healing process?
I think it came naturally. It came from listening to the need of the patients. So of course, we created a model with dentistry at the beginning, but then it didn't make sense to stay there. So that's why we created a model where dentistry was just the entry point. And now we combine it with functional medicine, IV nutrient therapy, fascia release, as you said, but also Chinese energy medicine, homeopathy, because health is an ecosystem, not just a simple organ. So, for example, when we remove a toxic root canal or an infected extraction site, okay, we don't just stop there. We support the patient with IV, with vitamin C, with ozone to reduce inflammation and to boost the immunity. So we often add fascia release or lymphatic drainage to help detoxification and gut support to rebalance the microbiome. It's like opening every blocked channel in the body so it can flow and heal. I think the most powerful results come from this combination. You see, when dentistry to remove the hidden stressor goes with medicine and IV and immune boost, I think that works beautifully. And the symptoms of the patients after a dental extraction or after a heavy dental treatment is completely different. The symptoms are different. The patients feel more relief immediately. They feel or they tell us that they don't have, this chronic fatigue or this brain fog that they had. They can see clearly sometimes. Of course, every patient is different. So you need to adapt your treatment or your protocol to every individual. But they claim or they tell us different stories, personal stories, and relieved of their symptoms. That's the beauty of doing what we do. And that's why we believe in what we do, because the patients tell us their stories. And that's why we need to continue with this way of healing people.
And that is really inspiring, and it brings hope as well, I think, for those listening to know that there are different options that really look at the body as a whole, and that we also have different tools that we can use to support us as whole persons, right? And when you can go to a place where you can have all of that together, you don't have to go here and there. At least for me, I think it's a lot more easier and convenient, even from a patient's perspective of like, I'm being followed here, and I know I'm being looked at all the pieces of the puzzle, not just an organ or a symptom.
Yeah, and year after year, you develop also a network of physicians, of doctors, of practitioners that understand the philosophy and work together, basically. It's a small world.
Yeah. You've likely worked with patients who've seen multiple doctors and still didn't get better until oral health was addressed. Can you share a story where oral health turned out to be the missing link and changed everything for someone?
Yeah, there are many stories, but I would say one that will stay with me forever is the story of Sultan. He's a local Emirati guy from Ras Al Khaimah. And when that happened, he was just 17. And almost overnight, he lost the ability to talk and to walk. So in the morning, the parent comes to his room, and of course, they don't know what to do. So they rush to the first hospital, and they did MRI, brain scan, endless. So they saw endless specialists, but no one could explain what was happening. And one day, the mother remembered that only a few months earlier, Sultan had a root canal treatment on the front tooth. So when we looked, we found a severe hidden infection and toxin in that specific areas. And once we treated it, it healed. The health began to shift. So I would say almost immediately he could talk, and it took a few weeks before he could walk again. And now he's fine. But that moment reminded me why this work matters so much. And the key to healing isn't found always in the brain scan, but more to try to find the root cause of the issue.
Wow, that story is incredible.
Yeah,
and powerful.
Touched me a lot.
Yeah. Okay, thank you for sharing. If you could redesign the system, how would you want medicine and dentistry to collaborate to support true long-term healing? What do you think is still missing in how we train healthcare professionals or how we educate the public?
If I could redesign the system, I would put medicine and dentistry under the same roof, definitely. The mouth is not separate. It's actually the first step of digestion, immunity, even brain health. And yet we still train doctors and dentists in two different worlds. So we both miss the bigger picture, I would say. And what's missing also in our education is that we train dentists. I would train dentists to use non-toxic materials only, and to avoid metals that corrode with saliva and create hidden stressor for the immune system. So I would really find a system that complements each other rather than oppose each other. True healing means doctors and dentists working hand in hand, looking at the patient as a whole. And that's, I think, that I would change to have a better holistic approach.
Yeah, absolutely. And I think I said this before, but I'm still going to say it again. We see a lot of change in the world nowadays when it comes to integrative health and medicine and functional medicine, and all that is coming up. But we don't see that many clinics with working in collaboration with a dentistry part. And I really think that is something that needs to be addressed. Just out of curiosity, David, what do you think, how do you think that is evolving with all the change that is happening in the health world nowadays? Do you think we are closer to that start being seen more and more, or you think we still have a long way?
No, I think we are getting closer. I think sooner or later there will be a tipping point, a shift, where people will want natural medicine or will try, not natural medicine, but they will try to understand. You see, when you have an acute infection, I would always recommend to use the Western system and use antibiotic. But when you have a chronic inflammation, I would try to use a gentle and natural approach like the Chinese medicine. You see, combining both, you get much better. And we don't have to oppose one system or the other. You just handpick the right one when you need that. And I think we need more social skills. We need more human empathy. But at the same time, we need also AI, because AI will help us combining all the medical systems that exist. So I think I would be very positive and enthusiastic as the future for healthcare. I really think that we will be better, and there will be a shift, and people will want this kind of medicine. I'm quite sure of that, and I hope so.
Yeah, absolutely. And you touch a point that I want to reinforce, which is very important. It doesn't mean we need to oppose one and another, the conventional and the more integrative, but just understand to, based on what we are dealing on, what are the issues or imbalances that we have, which solution, which one brings the right solutions, right? Because with the chronic diseases that we see nowadays, as like the majority of things that people are facing, we cannot keep treating just the symptoms. We need to look deeper at the root. Otherwise, we won't get the results that bring balance into the system.
We need that, I would say, definitely, but it needs to make sense. I think we need to educate patients. Patients now, they can listen, they can hear, they can see a lot of things. So they are able to understand their own disease and how it works. So I think it's our duty to educate even more patients in the right directions, so that they understand and choose their own treatment, their own protocols. Because you see, we're all different. So I don't believe in one treatment for all patients. I really think that we need to optimize and individualize each treatment for the patient. Once we understand that we need to educate the patient, and once the patient feels comfortable because he has the human touch, the human contact with the practitioner, he understand because he feel understood by the practitioner, and he feel that he understand as well his protocol, that makes a huge difference in not only the treatment of the disease, but also the happiness of the patient.
Yeah. And those are topics that we could kind of dive into, the human empathy and the social skills, right? That is something that is really needed. And also for me is what I call with my clients is taking ownership of their health. People really taking ownership, really becoming agents on their own journey, on their own healing, on their own health and life. That is super important. And for that, you need to be educated. So you can feel empowered and you can take action or make decisions from a different place, right?
Yes, and there is always hope. Even if you feel overwhelmed, even if medicine hasn't given you all the answers, your body has an incredible capacity to heal when we remove the stressor and support your right way. So if you find someone who understands, who has empathy, and offer you protocol that you understand, then that's the best way on your way to on your journey to heal.
Yeah. So you've pioneered many innovations from ozone floss to regenerative protocols, and I know you're always thinking ahead. What's next for you, and what are you most excited about when it comes to the future of biological dentistry and biohealth? And I also know that stem cell research is on your radar. So I don't know if you want to talk about the role that you see it playing in oral and systemic healing in the years to come.
I think there are lots coming on, and what we need is to always dig deeper, research always, read scientific paper, and we have the chance to have many doctors working with us together. And together we are so strong because we all read different papers and we see different options, and we have the chance in Dubai to have the possibility to experiment different protocols that we see have great result, and they are backed by science, of course. So I think ozone, even more ozone therapy, are definitely the way to go. I think we will go lots of genetics happening soon. We will go into lots of new therapy to mix different organs and different entity of the body. So I really think that combining different knowledge will get us to the next level of medicine. Genetics definitely a good way to look for the new medicine.
Yeah, that will allow us to have more precision, like you were saying, because each individual is different. And, you know, I have a very fun story. Even within ourselves, things can be so different. So I have implants, right? And I had to do, to put some bone. And I did the same procedure on the same day in both sides of my mouth. And one went really well and it healed really well. And the other one got infected. And, you know, and it was a big problem, and I had to take it out. And it's so funny because it was in the same day, the same person, and I got two completely different results. So even our own bodies, they can react to things differently depending on the moment, on the environment, on so many things. So yeah, I think bringing individuality and using genetics for that is really something that it's going to be really powerful in medicine.
Yes, yeah, I agree with you. Knowledge, growth, I think we always need to research and do not harm as well. So we really need to use biocompatible materials, non-toxic materials or materials that create allergy or inflammation. I really think that, especially in dentistry, we need to make sure that we don't harm the patient.
Yeah. All right. So I know that there are thousands of things we could talk about, but if you had to choose 5 simple lifestyle shifts that really move the needle for oral and systemic health, what would that be? You know, some daily habits or tools or practices that people can start doing today to support their oral health and by extension their whole body health.
So I would say focus on 3 things. First, nutrition. So definitely less sugar or processed food. More minerals or more vitamins like C, like D3, K2, magnesium to strengthen your teeth and your immunity. Second, I would say daily habits. Brush with hydroxyapatite toothpaste instead of fluoride. Clean your tongue. Don't forget the space between teeth, so floss. And third, I would say lifestyle. Have good sleep, managing your stress. Nose breathing, it's very important as well. Because if you do mouth breathing, it can create also lots of consequences. So check that. Even if you're young or old, it doesn't matter. You need to reduce or to stop your mouth breathing. And as a big red flag, I would say if you have bleeding gums or bad breath or recurring sinuses issues or unexplained unexplained medical fatigue. Yeah. And I would ask definitely for, in this case, for CBCT, because this is the only way to detect hidden infection, FDOG or cavitation, that silently drain the immune system. So the mouth is often the missing piece, I would say.
And is there anything specific that you recommend when it comes to oral hygiene products? And I know you have your own toothpaste for those that are listening to us and are in Dubai. I don't know if we can get it already in Europe, but
yeah, I mean, you can have it everywhere. But if you're in the US, I would say choose Boca or Risewell toothpaste. If in Europe, you can choose Boca. I think they're delivering in Europe as well, or our toothpaste. And in the Middle East, definitely our toothpaste. But definitely check the ingredient. So no fluoride, but hydroxyapatite, and the concentration of hydroxyapatite needs to be above 10%. Make sure that you don't have SLS inside. So you don't want to have, a foamy toothpaste.
yeah.
Just check the ingredient and try to see what's most natural. And it's very easy, to do some research. You type in the ingredient into ChatGPT, they will tell you exactly.
Yeah.
So it's
And
easy.
and you talked about the foam, and I know for those that are not used to and haven't been used more natural toothpastes, that will be strange at the beginning, but you will get used to with the time, right?
Yes. Yeah, and it can be also tingling. I know that some of our patients mentioned that sometimes when they use the mint one, they have some tingling effect. It's just because we have clove, and clove is great for healing and rebalancing the microbiome. But yes, it can happen this kind of tingling effect. So what I always try to say to my patient is that you can heal lots of things a natural way, but it takes lots of time. It's like a chronic inflammation. It takes time to heal. You need to understand that, and you need to have this new habit of not rushing into something, But
Yeah.
you must see that with your client.
And that would be another topic to explore for today's world, right? Rush and people understanding that it takes time to heal. So for doctors, coaches, or therapists listening, how do you, like, if they are listening to the podcast, right, and they want to start looking to support their clients in this such important piece. And I know you already mentioned some of the red flags that they can be looking at, right? The bleeding gums, the bad breath, the recurring sinus. But how can they collaborate with biological dentists to help? Like, do you see, like, do you think dentists will be open to partnerships or, referrals? And if they don't know anyone that is a biological dentist in their area, I don't know, I was just thinking, how can we?
So if there is an independent website called the EIOMT,
EOM.
Yeah. International Association of Medicine and Toxicology, EIOMT. Okay. It's independent. It's in the US. If you go into this website, first of all, you will learn a lot about what's impact your health. But you will find dentists all over the world that are the credentials for treating the patients in a more natural way with a degree, because when you want to use a smart protocol, for example, you need not only to have the training for it, but you need also to have the equipment for it. So you can, I would say, trust this website and go for the closest one. But you do also have the possibility to do some online consultation, because if you send to a biological dentist panoramic, they will tell you what you have. And then you can have the protocol and you can see the closest dentist or even your dentist. If he's open-minded, you can see him and get in touch with a biological dentist that can explain the protocol that we are doing.
Okay, that's amazing to know that, and I hope everyone listening will start having that in mind when looking at their patients. So we are close to the end, but I have a few more questions for you. And I heard you were releasing a book this autumn, highlighting key moments from your career and the people who influenced you and the lessons that shape your path. What inspired you to write this book now, and what can you tell us about it?
I talk about different stories from my personal life or from my professional life. We mentioned a little bit earlier the story of Sultan, so dedicated a whole chapter on Sultan's story, and also a personal journey, because I think it's important for me, for my patients, to know the reason why I became a biological dentist. I think it makes a lot of sense, deeper sense of connection, and I needed to do that. So now it's going to be released next month. So I'm excited. I'm afraid, but I think it was an important step for me, for my journey.
Well, congratulations, and I'm looking forward to see that and to read that. I really believe that we need, like we mentioned before in our conversation, to bring each time more the human side, right? And listening to other stories also, for those navigating health issues, can bring a lot of hope. And I think that's really, really important, because so many doctors or health professionals, they deal with so many different issues, and that is what happens between the four walls or with all these stories sometimes doesn't get out, and that can really have an impact in the life of others listening to those stories. So good luck with your lunch, and congratulations again.
Thank you, Marta.
And if someone listening is feeling overwhelmed by symptoms or navigating a chronic illness or cancer treatment, what would you want them to know about healing? What message would you share with someone who feels stuck or forgotten by the system?
I say that there is always hope. I think that if you feel overwhelmed, there is hope. And I think that your body has an incredible capacity to heal, especially when we remove, the factors that stress the body. And healing is not about fighting harder. I think it's about creating the right conditions for the body to restore balance, reducing inflammation, or even supporting the immune system. And yes, it starts with the mouth. I think we are not just a diagnosis or a tooth. I think we are a whole person. And when we treat you as such with compassion, and of course with backed up with science, so I think that healing becomes possible. And my message is just simple: we don't give up. There is always new doors to open, and sometimes the key is closer than you think. So yeah, hope. And if I have one message, I would say feel good and smile.
Yeah. Hope and also not giving up. That's such an important reminder. Thank you for that. And to close, because I always like to ask this, what's one value or belief that continues to guide your life, your work, your leadership, and your mission?
We have 3 values at Roze BioHealth. We have human, elegant, and remarkable. The 3 values shape my life, shapes the journey of all our people. And I think we try in a very simple way to feel good and to smile, because smile is not just teeth, it's energy, it's confidence, it's joy. So that's why I want for everyone listening to feel good and smile, and to share that smile with the people you love. I think it's very important to be in the present moment and to have positive vibes. I think it's very important.
Yes. Smile. A smile can change a lot of things, right?
It can.
Well, David, you left me with a smile. So thank you so much
Good.
for sharing your story and wisdom with us today. Your work is a powerful reminder that healing happens when we zoom out, when we treat the root, not just the symptom, and when we remember that the body, like the person, is deeply interconnected. So to everyone listening, thank you for being here. I hope this conversation invites you to look at your own health with more curiosity, compassion, and connection, and to not underestimate your oral health, whether you were dealing with ongoing health issues or simply looking to optimize your health. If this episode resonated with you, please subscribe, leave a review, or share it with someone who might need to hear it. And I will see you in the next episode of the Oncology Revolution. Thank you.